Well, good afternoon, everyone. My name is Brian Moore, and I'm the head of marketing here at SmartAction, welcoming you to today's webinar. We're calling this a virtual lunch and learn, as we are all secluded at the moment, and so hopefully trying to do at least a little something, potentially to brighten up your day with a free lunch, and also just doing something nice by supporting your local restaurants and takeout that certainly could use a lot of support right now. So, and in that vein, we're going to kick off today's webinar talking about our response that we're trying to do from our end, carrying our sense of responsibility into this crisis as we have been inspired by what others are doing. We're delivering what we're going to talk about in a minute, a no-fee rapid response virtual agent that we do believe is a necessary cornerstone to any business continuity plan for a contact center. With me today is Dan Fox. He's our VP of Product Marketing and Strategy here at SmartAction. Dan, good to have you with us today.
Hey,
and as you are settling in, we do want to make sure that you just pay attention to the Q&A box and also the chat box, so that way you can chime in and help drive this conversation as much as possible. We do have set content to talk about, but we like to be audience driven as much as possible. So while we still have attendees that are joining, let me go ahead and just set the table for the conversation. We are a provider of AI-powered virtual agents that use conversational AI to expand self-service over the voice channel, meaning them do over voice and chat. So as you can imagine, it's put us right in the middle of this fight where we're right in the middle of this with you with this pandemic, doing our end on the AI front. We operate conversational AI for more than 100 brands from the Fortune 500 on down. So we've been right there scrambling to help all of our customers react, just as I know those of you listening in have been finding ways to react to this crisis. And how do you maintain business continuity? How do you maintain business continuity? And for us, it's using AI to do that for our customers. Just one example. Was very, very early. The state of Washington, they were the first to issue the shelter-in-place order, hit them by surprise. All of this hit all of us by surprise, but it hit the state of Washington first. And that shelter-in-place order, we went into overdrive just to help with some of those businesses maintain continuity with automation. One example is a AAA club. They needed to support their members on the road with emergency roadside assistance service. Obviously, agent availability for them became in very, very quickly, short period of time, limited, and they needed to hand their CX to AI, so we were able to step in for them as we'd helped other AAA clubs. Now, that's one specific example, but we're not here to talk today about one-off applications for specific businesses. We're here to talk about the number one request by far that's come in from a number of organizations, all of them experiencing extended hold times for one reason or another, all COVID-19 related. And those hold times are related either to an agent availability issue. It could be spikes in commonly asked questions or spikes in a very particular type of interaction. So in response, we have built out a solution that is very simple. We call it I say simple. There's a lot of complexity to it, as we're going to show you in just a minute, but simple in the sense that we can scale it out very, very quickly. We call it a rapid response virtual agent, and it can be deployed in any environment and deployed very quickly. It can be customized for any organization, whatever your specific need is to combat extended hold times that are COVID-19 related. So frankly, it's was that a coronavirus cough I just had right now? Frankly, it's the number one piece of the puzzle that we feel that all organizations should have as part of their business continuity plan, in addition to the work from home front. This would really kind of take the AI front in that battle. And the biggest piece is that we are giving this tool away to organizations who really need it. We are waiving all upfront professional service fees. That means we're not charging for any of the work to customize the application to your business. We're not charging for any of the work to integrate into your environment. We're not the Red Cross by any means, but we know that AI to some degree can be a Red Cross of sorts for contact centers. So while this pandemic is in place, we just want to make sure that we're shouldering our load of the responsibility in this fight, just like everyone else is doing. As we see, all from Costco workers, on down to nurses. So now also with me today, or who was supposed to be with me today, is Mark Landry, our human experience analyst. He does a lot of our design work. He had to be pulled away this morning due to a very urgent project building that he's doing with this rapid response virtual agent, and we're doing it for the COVID-19 national hotline. So, but Dan's going to fill in and cover all of that. And in very short order, we're going to get into an actual live demo of what this looks like and understand step by step what it means and how you might be able to apply it. Just for those that have joined in that maybe have no background or history with SmartAction, the only need to know on screen is that we deliver AI-powered virtual agents as a service. That means we bundle the full conversational AI stack, all the technology, and bundle it together with end-to-end CX services, everything needed to run it. The design, the build, the ongoing operation. Most of our customers will start in voice for the biggest ROI and then scale digitally to scale that experience to chat or text. When it comes to conversations with machines, particularly over the voice channel, they're not easy. It's not just design, build, and poof, you're done. It's why you do need a team of specialists committed to tuning the application week in, week out, pouring through data and analytics, listening to call recordings, meeting with your teams weekly on stats and objectives so we can constantly iterate and chase the most frictionless experience possible. We integrate with every platform, and we'd at least like to think this approach has been working for us, as our customer reviews have made us the top-rated solution on Gartner Peer Insights. So that's the only plug that I'm giving you about SmartAction. So should you by chance be in the market for expansion of self-service capabilities. But what we're here today to talk about today, and what you're here to listen about, is what we're doing in this rapid response solution to combat COVID-19 related hold times. We did a survey just 3 weeks into the pandemic as it was rising. I think at this time when we did the survey, only the University of Washington had a shelter-in-place order. And everyone had the sense that one was coming soon for theirs. I'll highlight just 4 questions from the survey. This is from near 50 customer service executives across different organizations and sizes, but all on the larger enterprise side, asking how did they rate the potential threat of COVID-19 to their contact center operations? And if you look at the answer, 63% of those said it absolutely presented a high threat to their contact service operations. A follow-up question to that, does your contact center have a best case plan or worst case plan in place now, or are you in the process of planning them? Well, about half have plans solidly in place. The other half, we're trying to put those plans together on the fly. So as you can see, really hit organizations hard on the business continuity planning front. We asked an open-ended question: what in technology initiatives is this driving? And you can see if any of this resonates with you. These were an open-ended question so we could get detailed responses. However, we found that all these responses fell into one of 3 very clear, distinct categories. 26% said there was no technology initiative. They have everything that they needed. 30% were looking to expand self-service automation, either over chat or voice or both. And then 44% said number one for them was implementing work from home technologies and capabilities so they didn't suffer too much downtime with their call center. And last, this question, what do you see as the actual threat to your operations? Well, as you can see, it's across the range of limited agent availability. The same as that relates to BPOs that could potentially suffer, as we have seen in offshore like the Philippines. There is not for them even a work from home option with the lack of technology capability to do that, and shoddy internets or the ability to even have that space. Long hold times were expected by 51% of organizations. So parlaying that in the kind of the fear of the coming hold times, well, this in front of you is just a small sampling. We would have put more on screen if we had more room to fit. We have just been inundated from different organizations that are dealing with some of these whole time related issues. As you can see on screen, that's just been an absolute killer for a lot of these organizations. My own son here, my own family broke his phone. We have T-Mobile, tried to use the online self-service tools to get a replacement. And of course, in process of doing so, there was a quote unquote error. Please call into 1-800. And after calling in, there was absolutely no way of finding our way to a live agent, and continue to just get hung up on. So now my son stuck here in quarantine without a phone, and trying to suffer his way through it. And hopefully we can find our way to a T-Mobile rep to relate that. Well, what is the biggest reasons, what is the source, to these whole time issues? Well, one is obviously it's the agent availability side, whether or not there's even work from home capabilities, or might be relying on a BPO that doesn't have work from home capabilities. The other is the threat of what does happen if some of that agent population goes down sick. And then the other element of this is any crisis creates a spike in commonly asked questions that don't necessarily need human assistance, but they call in anyhow. Not a lot of folks are proactive about in advance of going and reading FAQs, on your website. They just call in. And of course, that takes up time and attention, that needs to go from those that are more deserving. And in other cases, there might be one type of interaction. And Dan will speak of it in a minute, that we're resolving right now for Royal Caribbean, where it's a particular interaction that never had high volume before, and suddenly that one interaction has a lot of volume now, and it's beyond what agents can handle. So what has been the real missing link? Why is this whole time spike? Why is it happening? Why were we not prepared for it as contact centers? What was missing? And the missing link is here, what we're talking about today, that we've been asked by a number to develop. And of course, all of us should have seen this before, but the missing link is this layer between a caller and your live agents, and having that AI agent be able to essentially screen and help callers that don't necessarily need human assistance. And that's, we found, going down one of two very common paths. One path is the commonly asked questions, the ability to dip into your FAQ, interact with a customer and be able to handle that, get them off the phone line to a channel switching experience, have an interactive FAQ bot to handle what they're asking about immediately instead of having to wait on hold. Or conversely, either in addition or conversely, it's a screening tool. The ability to triage, to ask a number of questions to find out if, in fact, is this a caller that should be escalated? And then how do we get them into an escalation path to be speaking with a live agent? So now that we have identified what the problem is and identified what the missing link is to an effective contact center business continuity plan, we have Dan Fox, who's joining us today, who played a large part in helping to develop this tool in a very short period of time, very robust tool. And Dan, you're going to give us a live demo of this, so those that are listening in can get an actual touch and feel experience of what this looks like, and perhaps understand how it might apply to their business.
Yeah. Let's jump into it. So what we're going to show is that I'm actually going to, Brian, if you want to pause your screen share, I can pop up my screen, and what I'm going to show is a mirrored version of my cell phone. What we want to show, as Brian alluded to, is how we can deflect calls that are incoming and push them to alternate channels to provide alternate resources. So I think the demo is going to be pretty self-explanatory. The one caveat I'll mention is, keep your mind open for what this platform is capable of. We're showing a healthcare demo because we know we've talked to a lot of medical groups who are just faced with a huge influx of calls, but we'll think about how this may apply to your own industry, and we'll walk through a few cases that we know about. So I'm going to go ahead and place a call, put it on speaker so you can hear it.
Thank you for calling Diego Healthcare. We are experiencing a high call volume due to COVID-19 inquiries, so hold times may be longer than usual. If you're calling with questions about the virus, I can text you a link to our COVID-19 Answer Center, where all of your questions can be answered 24 hours a day. Would you like to take advantage of this feature?
Yes.
I have your phone number ending in 1251. Would you like me to text the link to this number?
Yes.
Great. You should receive the text momentarily. Please follow the instructions in the COVID-19 Answer Center. If you still have questions after using the Answer Center, please call back and one of our agents will assist you. Goodbye.
So what we showed here is, one example where we actually initiated a hang up directly from the call. So this user said they wanted to, try out the FAQ center, and we automatically hung up. The cost savings of that, as you can imagine, would be significant. An alternate arrangement would be actually keeping them on the line to make sure that the service did the right job for them, and then keep them if they want to jump back in and they still need to talk to an agent. But we do have some tricks up our sleeve for how we can move this conversation to a live agent if necessary. So as you can see here, I got the text message. It says hello from Diego Healthcare. Click on this link. So I'm going to go to this link. And what I'm going to get is a rich web chat session, which could be initiated from any web browser on any device, as long as it's, internet enabled. So it says, welcome to the Answer Center. Please select a question for more information or type your question below. So from here, what I can do is, go with any of these three top options right here, or I can say I have another question, which I'll show you in a second. So let's just go to how is it treated. What I'm going to get is a simple standard answer that says there's no approved medication to treat right now. And from here, I'll get the remaining questions that I can ask, or I can say I have another question. So from here, what I can do is actually access a knowledge base. So I can say, is there a vaccine available? And what's happening in real time is that question is being submitted to 3 knowledge bases who are going to return the highest confidence rate and deliver us the best answer for this question. So it says currently there's no vaccine available. Did that answer my question? Yes. All right, here's another link in case I have in case I want more information from the CDC. Let's say I want to ask another question. So this time I'm going to say, what are the symptoms? So this is where we transition from an FAQ bot into a real screening bot. So here's the symptoms, but it says, would you like to take our self-assessment? Let's say yes. And what I'm going to get here is the start of a few questions to help screen whether my situation is urgent, or whether I need to talk to a medical advisor, or whether I'm okay and to just wait and stand by. So let's say I've not tested positive. And have I been exposed to somebody? Let's say no, who knows? Are you experiencing any of the following symptoms? So let's say I am experiencing 2 of them. So here I actually get a checklist and I can select as many that apply. Let's say fever and cough. Let's go ahead and submit. Are you in immediate distress? So in this question, if I answer yes, what it's going to tell me to do is, call 911 immediately. But for this example, let's say no. So here it says, although you're not in immediate distress, since you are showing symptoms, you should talk to a medical professional. It tells you how long the wait is using a real-time data access to talk to a doctor. And from here, let's enter in my contact information. And this is what I alluded to earlier when I said that we have a tricky way to get right to a live agent if necessary. So what I've done here is actually submitted my information, which will get submitted back to Diego Healthcare, our fictional company, which is then going to initiate a callback, at which point, when the whole time is over and an agent is available, I'll actually get a call to that cell phone number that I called from. So that's just, that's one use case. We can hop back into the presentation here. But what we wanted to show in that demo is how we can move seamlessly from a voice experience to an SMS experience, and then of course back into a chatbot experience. So this is a great example from healthcare, both an FAQ bot or a screening bot. Let's walk through a few more examples to kind of show how else this could apply. So the first one we'll go through is actually one we're working on with a major cruise line operator who, you know, if you've been following the news, as I'm sure you can imagine, all cruises are now, you know, canceled for the time being. So what this cruise operator is doing is actually issuing gift certificates through email for these canceled cruises. And what users can do is now call and use that gift certificate that they received to book a new cruise later in the year or next year. Today, that functionality didn't exist for you to rebook automatically using a gift certificate. We're actually building that for them. So understanding their issue is, you know, all these people are calling up to apply these gift certificates. So now we built a voice-based virtual agent for rapid response. So when someone calls the company, they'll be able to, you know, automatically go through the process of applying these gift certificates and actually booking a new cruise. So let's jump into the next one here. Another huge one that we're hearing from the market is appointments that are being canceled for service providers, or this also applies within the medical space. This happened to me today. I had a DMV appointment. It obviously got canceled. I got a text message from the DMV saying your appointment is canceled. Okay, so, you know, now if I want to go rebook one, I have to go back to the DMV website, find a time that's available. It's a chunky process. What we want to do is offer a virtual agent experience, not just, you know, reactively like you've heard, but actually proactively. So we can send a text message to anyone who may be affected to say, hey, your upcoming appointment, it is still happening. Do you want to change it or cancel it? And then what they can do through conversational SMS is just change their appointment, get new times that are available through a real-time data integration, and then get on their way. So, you know, not only did we provide them an alert, but we provided them a virtual agent experience, which allowed them to complete a transaction, which in this case would be a complete reschedule. The last example we'll, you know, kind of mention is in retail, which is, you know, greatly impacted from the merchandise inventories because of how many delays there are in getting these shipments out the door. What we also, you know, came across is in-store returns. A lot of retailers can't do in-store returns. This is kind of an example of an FAQ bot. So in this example, if someone chatted with them in Facebook Messenger, we could intercept that Facebook message with a rapid response virtual agent that could apply the appropriate messaging to say, hey, you know, we're extending our return policy for in-store until further notice, but also give them an option to mail in their order for return, at which point we can go through a conversation to provide them a shipping label so they can just return it in the mail and they don't have to come in store at all. You know, since we created this presentation, we actually had another one pop up, which is really interesting for a certain state unemployment line who's, you know, as you can imagine, they're getting swamped right now with people trying to complete applications to receive unemployment benefits. It's a 25-question survey that is done with live agents today. Right now, the live agents are just not available to answer these calls. What we're implementing in the next few days is an application where, you know, just like you heard in the demo, if someone calls to complete an application, we're going to send them a link to go through the application through a rich web chat session where they can complete all of the questions in that application. And then we pass that information back to the state and they can follow up with everyone who completed an application, which will allow them to save, you know, upwards of 10 to 20 minutes for every application that they have to complete. So, you know, just to lay out what we mean when we refer to a rapid response virtual agent, there's a lot of flavors of this, like you just heard. But to walk through the steps, you know, step one, intercepting callers with specific messaging, sending customers a text link, and then offering a chatbot session from the SMS. So we can jump to the next one here. what we want to do is just, show how seamless this can be. I think, 5-10 years ago, a customer would be like, hey, wait, what do I do? And I got to go to SMS. Now it's seamless. People are expecting these kind of experiences. So if you're able to cross channels in a really seamless way, like you saw in that demo, even though we hit 3 different channels, the user experience is super joined together, and you're guiding the customer rather than, leaving them in the dark. So in this, what we started out is offering the custom greeting, offering them a text example. In that example that you heard in the demo, we just say, do you want to call the number, that you're calling from? If I was calling from a landline, what I could have said is no, and then offered the cell phone number that we want to send the text to. And then step 2, getting the text like you saw, which contains a link to get you over to a chatbot. The one caveat I'll mention here is if it's a simple transaction, maybe you just do this all in SMS, and then you just have, you don't offer the web chat experience, and you just ask a few questions in SMS, which is great because it's a very accessible channel. A lot of people are comfortable with it, but obviously you don't have as many capabilities as you do in that chatbot example that you're seeing here, where you have buttons, you have yes, no's, you can kind of guide the user through the right experience. And as Brian mentioned before, there's 2 flavors of this, just providing the FAQ like you saw at the beginning of the chat, and then screening, which is like, hey, we want to complete an application, we want to complete a process, and you're guiding the user to get to the right answer.
So Dan, I had a question that came up earlier on, just architecture and integration. And I held off on that knowing these slides were coming. In fact, there's a couple different ways that this can be implemented in their environment, isn't there?
Yeah, totally. So when we're talking about the voice portion, a lot of this is flexible, so keep your mind open. But what we wanted to show is that there's 2 seamless ways that you can get this done. The first, probably not the best user experience as the next one, but in this one, what we're saying is keep everything in place, and all you do is have your IVR vendor, or if you have the ability to do it on your own, just front end your own IVR with a message that says, is your question related to COVID-19? And then they press 1, and then we would do a soft transfer via likely PSTN, unless you have SIP in place. And then we transfer that call gets transferred into our application, and we greet the customer and say, hey, would you like us to text you a link? And then if we need to move them to digital, then we allow them to do so. So the next part is probably the more optimal, which is sitting in front of the IVR, where all we would do is set up a soft transfer from your current toll-free number, where the customer calls in, there's a soft transfer immediately to us, and we front end the call. So we say, hey, thanks for calling company X. Is your question related to COVID-19? And then offer the experience that you heard in the demo, offer them the digital channels. If for any reason they don't want to engage with the virtual agent, or they're calling about something else, then we do a soft transfer back, and that can either go directly to your live agents, or you can put them into your existing IVR, and we can do that transfer likely via PSTN. So 2 ways to get about it, both relatively easy to set up, both offer their benefits. There's another one we're missing, let us know. The platform is pretty flexible, and maybe it doesn't start in voice, maybe it starts in chat, or it starts in text. There's multiple ways you could go about doing this.
Thanks, Dan. Now, we had put this slide in just at the very end to make a quick plug on why is it that customers choose SmartAction if you happen to be in the market for expanding your AI automation capabilities from simple to complex transactions. Don't think I need to cover this. I think we gave that plug on the About Us overview slide, but the only way to think of us is we're not just a technology provider. We're not in this just for selling software licenses and then pushing you out in the ship off to sea with a couple of oars and say good luck. We actually do the work for you on your behalf. So we step in more as a partner who's delivering both the technology and the end-to-end CX services to actually manage your CX for you. And we will just jump into next steps, because I know we're here at the bottom of the hour and we want to field any questions. A couple that have come in so far that we'll get to, and any other questions that you may have that you didn't ask, please just type them into the Q&A box or put them into the chat box and we'll answer here. Regarding next steps, I mentioned this on the front. We're doing something very different and special with this offer. We have stood up and built this application, but we are delivering it without any upfront professional service fee. And that includes all the work that goes into customizing the application to your need and to your business, and all the work to coordinate with your IT on your side to make sure that you are fully integrated and getting you up and running. Again, it's just us doing our piece in the 2 acres that we own in AI, where we know we can step up to the plate and try to do something socially conscious, in this time. As far as the actual fees that are related to ongoing fees on usage, we're passing those along at cost, and you can just get in touch with us to see what those are based on volume. So if this is something that you are interested, either for your environment or perhaps a colleague in another contact center who might, and they're combating hold time issues, you see a way to contact us, info@smartaction.com. Just send an email there, and somebody will reach out on our behalf and get you started with maybe a demo on your own end, understand your business need, and see if there's a fit for what you're doing. As soon as this webinar is over, you will be getting a copy of the presentation. We will also include a link to this solution page that has the demo that Dan outlined. And the moment that this renders, it takes a few hours, but once it has rendered, it will be uploaded to our YouTube video, and we will likely have somebody on our team socialize that link with you, likely tomorrow, so that you have it as your own resource, or perhaps you want to share with other stakeholders on your team. You will be able to do that. So for those that did join, if you have a hard stop, we thank you for joining. We hope that you enjoyed lunch and hope we brightened your day a little bit. And we will also encourage you, if this is not something that you have an immediate need for, please feel free, visit our LinkedIn channel and look up SmartAction on LinkedIn. You can find this rapid response virtual agent offer that we're delivering to the marketplace. If you don't mind, like, share, or comment so it goes to your other colleagues that are in your network of professionals, so that this hits those organizations that might be in need for something like this. So Dan, one question that I am going to just kind of combine together. One is, how difficult is the integration? I think you covered that a little bit in the reference architecture slides. But the other question here is, how long does it actually take to stand this bot up?
Yeah, I think, I'll give the consultant answer. It could be, as short as a few days. It could be a week. It kind of depends on how complicated what we're building out. But our platform is built for speed for these type of scenarios, and we've mobilized a team around this. So we're executing as quickly as we can. So it wouldn't be uncommon that we could get an application out the door in a few days.
Well, so the good example is right now, Mark was not able to join, who's one of our designers or oversees our design department at SmartAction. He's right now working on this rapid response virtual agent, customizing it for the COVID-19 national hotline, maybe even from a timeline perspective. Dan, how long do you see that taking before it is stood up?
Yeah, we started the application, scoping out the application last night. We have something that's being tested right now, and we should be able to get it out the door with reporting by the beginning of next week.
Cool. Well, so I don't see any other questions or comments at this time. So looks like that we are free to close. Of course, you will receive that email from us as a follow-up with the link to the deck and the presentation. So we're happy to oblige with any question you have there, or even on your end, if you have an initiative that you would like to take with us, you can see that at info@smartaction.com. We look forward to continuing the conversation with you. Dan, any final remarks on your end?
No, I appreciate everyone joining.
Yep. Hope you enjoyed lunch and hope to be talking to you soon. Thank you, everyone.